My wife is amazing. I told her at the time that I met her, I said, you know, you don't want to marry an old guy like me. Little did I know that I was going to put her through all these issues and health problems that I end up having. My name is Mike. I live in Vancouver, Washington. In 2010, I had a 5-level bypass operation. And in 2012, I started to not feel very well, going through test after test, trying to figure out what was wrong. We finally discovered that I had a mitral valve that was leaking really bad.
We actually went and saw the thoracic surgeon, and he didn't want anything to do with it. So we were thrilled when we had the chance to go to Swedish and see if maybe there was something that they could do. Dr. Barnhart gave him the confidence that you are going to be okay. We are going to get back to our normal lives. Things are going to be all right. And they were.
And then I was fine for a long, long time until I started having problems again. I went to a cardiologist here in town, and they put me on some different medications.
They said, oh, you should be good as new, but it wasn't that simple.
I had 4 heart attacks. Each one was a little worse. And I've been in both hospitals here in Vancouver.
And it was a whole lot of, we don't really know what's wrong with you. And they basically said, you probably should get your affairs in order. This can't be how it ends. Not already, no.
You know, I was fading, I think, that I was ready to give up. And my wife said, no, you're not going to give up. You're going to be okay.
He spent too much time in these hospitals fighting. He worked too hard to just go home and give up. And I wasn't going to let him.
Lori said, enough's enough. I'm going to call Swedish and see what we can do.
They gave us a new beginning a couple of years ago. They can do it again.
Because of the program that we have here that's so tightly integrated between heart surgery and cardiology, Dr. Barnhart called me and said, you know, can you look into Mike's case and see if you think you can help him? And after looking through his entire workup, I was about 90% sure that there was a vessel in his heart that had blockage that hadn't been recognized at the time of his angiogram. And I said, I think this is what's going on, and if that's the case and we can open it up for you, you're probably going to do much, much better.
Unbelievable. We hadn't heard that for so long. He took all the time in the world, explained everything to us. We had no idea what was causing all of that, and he said, it's right here, and I can fix that. And we're going to go in and fix that on Monday when you come in for your angiogram. He did.
To me, to end up at Swedish and walk out of there with a actually renewed life and the sky's the limit again, I just feel very, very fortunate having had the chance and the opportunity to have somebody help me like that.
We got our life back because of Swedish. And I'm so thankful, so grateful, so appreciative of everybody up there that thought we were worth spending the time to put us back together again.
It is so fulfilling to hear. I am so happy I was able to make my child's graduation, my grandchild's graduation. It's very fulfilling to have people come to you and say, I was able to do the things that I've been wanting to do for so long.
You know, it's what really brings meaning to me, what motivates me, is to see, like, firsthand the positive impact on that patient. And so when somebody comes back to me and says, you know, wow, what you did really made a big difference, it makes me realize that I'm in the right job. I'm, you know, fulfilling my purpose in life.
If we look at things historically, the way medicine has been structured in the past is with a focus on the healthcare providers and what they need to do to help patients. Our program is turning that around and looking at it differently, and we're starting out by looking at what do our patients need to get the best care that they can get.
The navigation program at Swedish will have several facets to it. First, the patient will have a nurse that will navigate them through the program.
The patient has somebody who's in the system who can lead you through so that it doesn't feel like a maze. The goal is making sure from the moment that patient connects with us that we get them to the right place as quickly as possible to see the right person and get the right treatment.
The second component really is patient education. And the patient education piece of this we feel is extremely important, probably something we haven't done as well as we should have in the past in healthcare, making sure that the patients are completely educated.
The more information that they can have that's delivered in a way that they can understand it and that they can process and that is very user-friendly helps tremendously for them to participate in their care and to have a better outcome.
And the third piece of this are quality outcomes. We have known about short-term outcomes in specific entities, but what we want to do is broaden that so that with essentially every patient that we touch, with every diagnosis that we make, we want to know what our outcomes are.
That informs what we do and making sure that we're delivering the best care to our patients. And it's treating every patient like they're our family.
Mr. Hauser really provided a good example of how every patient should be treated. We want to be a bit more deliberate and intentional as we go forward about how we take care of patients, how we deliver care, how we get them through the system. Because he is a shining example of someone who, if they get through the system, they will do well.
I would like everybody to be so lucky as to have the same wonderful experience that we had.
To be treated as a human being with feelings, and that they're important. They're not just a number, they're important. I think everybody deserves that chance.